Alopecia areata affects millions, causing patchy or total hair loss when the immune system attacks hair follicles. In recent years, Janus kinase, JAK inhibitors, have transformed treatment. Today we'll compare three leading options: Baricitinib, Ritlecitinib, and Deuruxolitinib. For many, hair loss is about more than appearance. It's about confidence and identity. Until recently, options were limited and often disappointing. But science has moved forward, bringing real hope. These new medications act like a manager calming an overzealous security guard, letting your hair follicles stay. We'll break down how these drugs work, what the latest studies show, and what makes each unique. This is about more than facts. It's about the hope these breakthroughs represent. Let's dive into the progress and what it means for you. Baricitinib, or Olumiant, was the first JK inhibitor FDA approved for severe alopecia areata in adults. This was a game-changer for those with few options. In clinical trials, about one-third of patients on the 4 mg dose saw at least 80% scalp hair regrowth after 36 weeks. Real-world results have echoed these findings, showing consistent effectiveness. Side effects include upper respiratory infections, headaches, acne, and high cholesterol, things your doctor will monitor. Baricitinib is an oral tablet, usually 2 mg daily, with the option to increase to 4 mg if needed. Dosing can be adjusted based on your response and side effects. The flexibility allows for a personalized approach. Baricitinib paved the way for new treatments, proving that targeting this immune pathway can deliver real results. It's not a one-size-fits-all solution, but it opened the door for more options. The key takeaway: Baricitinib was the pioneer, setting the stage for everything that followed. It's a powerful tool for patients and doctors alike. Its success inspired further innovation in alopecia treatment. For many, it was the first real hope in years. Baricitinib's legacy is its role as the trailblazer in this new era. It remains a cornerstone in the treatment landscape, and it's still changing lives today. Ritlecitinib, or Litfulo, stands out because it's FDA approved for both adults and adolescents, 12 and up. As we discussed in our earlier video about the FDA approval of Ritlecitinib, and I'll link it here for you, it is a huge step for teens facing the emotional impact of hair loss. In the Allegro trial, nearly 23% of patients on the 50 mg daily dose achieved 80% or more scalp coverage after 24 weeks. It's not a cure for everyone, but it offers significant regrowth for many. Ritlecitinib works especially well in early-stage disease, in females, and in those with milder forms. This helps doctors personalize treatment and set realistic expectations. Its unique dual mechanism blocks both JAK3 and TEC kinases, offering a more targeted immune response. The oral once-daily dosing is simple, important for teens and adults alike. Ritlecitinib's biggest contribution is expanding access to younger patients. It brings hope to families who previously had few options. Its effectiveness in specific groups and unique mechanism make it a key player. Ritlecitinib represents a more inclusive approach to care. It's about meeting the needs of all ages. For many, it's the first step toward regaining confidence. Ritlecitinib is changing the landscape for young people with alopecia, and it's just the beginning. Deuruxolitinib, or Leqselvi, is the newest FDA-approved JK inhibitor for alopecia areata. Its arrival adds another powerful option for patients. In the Thrive AA trials, 42% of patients on the 12 mg twice-daily dose achieved 80% or more scalp coverage. Even more impressive, 83% of responders maintained their results for up to a year. This long-term durability is a major advantage. A recent meta-analysis found Deuruxolitinib at higher doses to be the most effective of the three for significant regrowth. Dosing comes in 8 mg or 12 mg tablets, both taken twice daily, allowing flexibility. Doctors can tailor the dose to maximize results and manage side effects. Deuruxolitinib's high effectiveness and staying power make it a standout. It raises expectations for what alopecia treatments can achieve. As the newest option, it's quickly becoming a major contender. Early data is promising for those seeking lasting results. Deuruxolitinib is setting a new standard for efficacy and durability. It's an exciting development for patients and providers. The future looks bright with Deuruxolitinib in the mix. With Baricitinib, Ritlecitinib, and Deuruxolitinib, we now have real choices. Deuruxolitinib leads in effectiveness for adults, But Ritlecitinib is the only FDA-approved option for adolescents. Baricitinib has the longest track record and proven real-world results. The right choice depends on age, disease stage, and personal health history. Early treatment is key. Patients with shorter disease duration respond better. Don't wait to seek help. Early intervention can make a big difference. Each drug has unique strengths, so the decision is highly personal. It's not just about numbers, it's about what fits your life and goals. The existence of 3 strong options is a triumph for the alopecia community. Personalized medicine is now a reality in this field. The best drug is the one that's best for you. Talk to your dermatologist to find your best fit. The goal is to empower you with options and hope. With any advanced treatment, careful oversight is important. Regular monitoring by your dermatologist is necessary for everyone receiving these therapies. Expect routine checkups and blood tests before and during your treatment. Your doctor will keep an eye on your blood counts, liver function, cholesterol, and screen for infections. Ongoing follow-up helps catch any issues early and keeps you safe. If you experience any problems, your doctor may pause or adjust your treatment. Open communication with your doctor is crucial. Report any new symptoms right away. The safety profile is a key part of the decision-making process. Weigh the benefits of regrowth with your doctor. For many, the potential for restored hair and confidence is worth it, with careful supervision. The goal is to maximize benefit and minimize risk. Diligent screening and monitoring are your best safeguards. A strong partnership with your doctor is essential. Safety and success go hand in hand. Science never stops. New treatments for alopecia areata are on the horizon. Ritlecitinib, another JAK inhibitor, is showing promise in trials. Topical versions are being explored, aiming for fewer side effects. The future is about personalized medicine, matching the right drug to the right patient. AI tools may soon predict which treatment will work best for you. This could save time, money, and emotional energy. Deeper understanding of the disease is leading to more targeted therapies. The pace of research is accelerating. The next 5 to 10 years could bring even more effective, safer options. The present is bright, but the future looks even better. Innovation is driving hope for everyone with alopecia areata. Stay tuned for new breakthroughs. The best is yet to come. We've covered the latest science and treatment options for severe alopecia areata. 3 FDA-approved JK inhibitors now offer real hope for regrowth. Choosing the right one depends on your age, health, disease stage, and personal goals. It's a shared decision with your dermatologist. Don't go it alone. See your dermatologist for expert guidance and monitoring. They'll tailor treatment to your needs and keep you safe. The landscape has changed. There's more reason for hope than ever. Celebrate the progress and the options now available. You have choices, and you have a path forward. Take the first step. Make that appointment. The journey to regrowth and renewed confidence starts with expert care. These breakthroughs are transforming lives for people with alopecia areata. I hope you found this video helpful, and that it added something new to your understanding of alopecia areata and its latest treatments. Thanks for watching, and if you'd like to see more updates like this, don't forget to subscribe.